Good morning, everyone, and thank you for coming. Hello, Fiona. I have a few updates to provide following this morning's National Cabinet meeting and the subsequent Emergency Committee meeting. But first, I'll provide a COVID-19 update for Western Australia. This morning, we convened an emergency meeting to discuss the latest situation in Queensland. I'd like to thank the Chief Health Officer, Dr. Andrew Robertson, and Acting Police Commissioner, Cole Blanche, and their teams for their efforts this morning. The good news is that WA has recorded no new cases of COVID-19 overnight. This result includes the paramedic following the PPE breach associated with the COVID-19 positive patient. This means 2 people associated with those breaches have returned negative results. The test result on the nurse is still pending, but is expected to be negative as well. All 3 will remain in hotel quarantine and be tested again before they complete their 14 days of quarantine. Our COVID-19 patient in hospital, the 86-year-old woman, remains in a stable condition. I want to thank our hospital staff for the amazing work they are doing in treating this patient in a negative pressure room. Now on to Queensland and the fast evolving situation there. Our Chief Health Officer has been in contact with his counterpart and has provided new updated health advice this morning. The case of the hotel quarantine cleaner in Brisbane is extremely concerning. Our health officials and Queensland health officials both agree this is a dangerous situation, not only for Brisbane, but for the whole of Australia. This is Australia's first known case of the super fast spreading UK variant of COVID-19. Evidence shows this variant is 70% more infectious than other strains. We all know how easily the original strain of COVID-19 transmits through our community, which means this strain is now setting a whole new benchmark in our fight against COVID-19. The rulebook continues to evolve, as does COVID. As a result, we cannot hesitate. We cannot sit back and wait and watch. With COVID-19 and this new strain, we cannot assume anything. Given the number of contacts and potentially affected venues and locations, we need to move fast. Queensland and the whole of Australia are on high alert. I 100% support the Queensland Premier, Anastasia Palaszczuk's decision to put Brisbane into a 3-day lockdown. It's the right move. It's the smart, preemptive move that's necessary in the world in which we live. Our thoughts are with our friends and family in Queensland. Tonight, when they go into lockdown, they are not just doing it for Queensland, they are doing it for the whole country. Based on the latest up-to-date information and new expert health advice, a hard border will return between Western Australia and Queensland. This will come into effect from midnight tonight, that is 12:01 a.m. tomorrow, the 9th of January. This means Queensland will move from a very low risk state to a medium risk state under our health advice. This is the same approach taken to Victoria on New Year's Eve. As a result, travel from Queensland will no longer be permitted unless you are an exempt traveller. This also applies to anyone who may have been in Queensland since January 2 and hasn't completed 14 days in a lower risk state or territory. This means all arrivals will need to meet a strict exemption category to enter WA. The exemption list is the same as it stands for New South Wales and Victoria. Compassionate grounds will be considered by WA Police, as has always been the case. This will include Western Australians who recently travelled to Queensland and need to return to WA. These people will be assessed by WA Police and will be required to complete 14 days of self-quarantine on arrival into WA. WA Police advise we have had about 7,500 arrivals from Queensland since January 2. The health advice is recommending these recent arrivals be tested by Tuesday. Obviously, today is 41 degrees Celsius. So from a health perspective, we're not telling people to rush to a COVID clinic today. The Department of Health will increase resources at our COVID clinics to ensure we can get through as many tests as quickly as possible by Tuesday. But you do need to expect delays, just like we see everywhere around Australia and around the world. So we ask everyone to be patient, to bring water and sun protection in case the wait is long. They will also need to be tested on day 11 of their quarantine. Anyone in this category will be contacted by WA Police with these instructions as a result of the G2G Pass declaration system in place in WA. Today there are 9 flights from Queensland due at Perth Airport. We're expecting around 1,400 passengers. These people will be granted entry and will need to be tested on arrival at the airport. This will also likely result in delays in being processed at the airport, so we please ask for patience. They will immediately go into self-quarantine for 14 days and will also need to be tested on day 11. My advice to those who are not West Australians returning home would be to return to Queensland, unless you have personal circumstances that require you to stay in WA. I understand this is going to cause many problems for many people, but we need to take this course of action to protect all Western Australians. These are extraordinary circumstances. We're not just dealing with the COVID-19 of 2020. This is a whole new beast, and we must take action to prevent this deadly virus from spreading into our community. I have a responsibility for every Western Australian, and I need to do what is right to keep our state safe and strong. I want to make this point. If you are a recent arrival from Queensland or arriving today, you are free to depart WA and return to Queensland immediately. You just need to follow the instructions from WA Police and our health professionals and provide the necessary information before you leave self-quarantine and prior to your travel. The Western Australian community has been COVID-free for 272 days now, nearly 9 months. I want it that way. We don't want to see community transmission in WA because we know what that means. People's lives at risk and businesses closed. All the way along, throughout this pandemic, our best defence has been our border controls. Now is not the time to be taking unnecessary risks or being complacent. We must all do our bit to keep our community safe. I also want Western Australians to understand that unless it is absolutely necessary, please avoid travel outside of WA. Things can change extremely quickly, and I know it will cause problems for some people, but we need to follow the health advice. I also want to be clear. If you have come into contact with someone who recently arrived from Queensland, you do not need to self-quarantine, and you only need to be tested for COVID-19 if symptoms develop. Thank you to everyone for your understanding and patience. I think we all thought the worst of COVID was behind us, but 2021 now looks a lot like 2020 right now. But what we know now, compared to this time last year, is that the best approach is to eliminate the virus from our community. In relation to National Cabinet this morning, it was a very productive meeting with important outcomes. We are implementing the recommendations of the AHPPC, our expert panel of health advisors. It's something that I fully support and will help keep Western Australia safe. This includes every international arrival in Australia will now need to receive a negative test result before boarding their flight. In addition, the wearing of masks is now compulsory on flights at all times. As a result of the new strain, Australia's international arrival cap will be halved until at least mid-February. This means Western Australia's weekly arrival cap of 1,025 will go down to 512 a week. This will assist in ensuring we keep our hotel quarantine standards to the highest level and we minimise the risk. We will also be implementing further changes for all quarantine workers. This will include daily saliva tests for all workers on top of our weekly PCR testing regime. These are positive measures to ensure we keep WA safe and strong. I can now take your questions.
Why are you
Yeah, our model the whole way along is to treat a state as a whole, and the reason for that is this: COVID does not respect postcodes. It doesn't respect a postcodes. People from Brisbane could travel to the Gold Coast. In fact, they do. They could travel to the hinterland. They could travel to the Sunshine Coast, Townsville or Cairns. So therefore, we treat Queensland as one. We are unique in that regard. Other states used to do it. The other states have stopped doing that. But we've found that it works. And what you've found, for instance, in the New South Wales outbreak, is people from the northern beaches spread the virus to Wollongong. They spread it throughout Sydney. They spread it to the Blue Mountains. That sort of thing occurs. So therefore, we're treating Queensland as a whole because we believe, based upon expert advice, that is the safest measure to keep our state strong.
On that point about interstate travel, is that don't travel interstate full stop, or only travel interstate if you have essential reasons to do so?
Well, my advice to people is don't travel to other states of Australia unless it's absolutely necessary. So don't leave Western Australia unless absolutely necessary. We're not out of the woods. We're not out of the woods yet. And you never know when we need to close down a state border, and then you have to come home and quarantine. And also, you go to other states. You never know if you're going to contract the virus. So this is highly precautionary. Highly precautionary. Our approach as a country is so cautious, but I'm pleased. I'm happy it's cautious. I'm pleased the Commonwealth has done the things they've done in terms of the international caps, in terms of the masks on aircraft, because it is very, very cautious. And when you're not cautious, when you don't take the appropriate precautions, you end up like Britain or America. And we do not want to go there. We don't want to go anywhere near that. In Britain, it's a disaster. It's a human catastrophe in Britain. And many people, particularly the elderly, will die in Britain in large numbers. Australia, as we all know, very similar country to Britain, very similar to the United States in many ways. Yet we have a very different outcome. And the reason we have a very different outcome is we have been highly cautious, and we've used the things that define us to our advantage. Things like our isolation, our island status, our borders. If Britain had done that, they'd be in a much better position now.
So why not just shut off to the rest of the country, WA?
Well, we did that. We lifted the interstate borders when other states eliminated it, and obviously it's come back in some states. But currently, there is no cases in Tasmania or the Northern Territory or South Australia. But I'll just say this. Obviously, if this keeps happening, we don't rule out just shutting the border completely. That would be a measure that, if the health advice said we needed to do it, we would do it.
What would trigger that?
Well, it'd be spread, I expect, throughout the other states. So, as I said, Tasmania, South Australia, Northern Territory, ACT, currently don't have any community cases. But if they did get them, and the medical advice was we need to close down to the entire country again, well, then that's what we'd do.
Queensland's gone to medium risk now based on one case. That's a new situation. Is that just because it's the more virulent?
Yeah, that's right. There's great, and the Commonwealth has now halved the international intake. They didn't close down to Britain. So the Commonwealth hasn't closed down to Britain. Other countries have closed down to Britain and South Africa and Nigeria. The Commonwealth hasn't done that. Basically, the advice is the British strain has spread to a score or so countries around the world. So even if you close down to Britain, other countries could bring in the British strain. So therefore, they haven't closed down to other countries. But the reason that this is being treated in such a strong and perhaps extreme way is because it is that British strain, which is very fast spreading, and you see what can happen when it gets out of control, as has happened in the UK. The UK is now going into what is third or fourth lockdown. A human and economic catastrophe is happening in Britain. And obviously all of the premiers and the Prime Minister don't want to see that happen here. That's why we're taking these very cautious steps.
7,500 people.
Saying elimination instead of flattening the curve now?
Yeah, I've been saying elimination for months. We need to eliminate. We're an island. And we need to use our advantages to eliminate the virus. The idea that you keep the virus ticking along and you close down postcodes or you deal with a cafe or a restaurant here or a suburb there, I don't think is right. What Brisbane has done is the right model. Closing down, locking down, mandating mask wearing to eliminate, which is what Adelaide did 2 months ago, is the right step.
7,500 people who are potentially going to have to self-isolate here. How will police keep track of so many people at once?
Like we have with Victoria, and as we have with New South Wales, exactly the same system. I'll let the Deputy Commissioner comment after I finish on exactly what police do, but this is not unusual. We did it 2 months ago with South Australians, then we did it with New South Wales residents, then we did it with Victorians, and now we're doing it with Queenslanders. It's exactly the same system.
Why is it appropriate to have people fly back to Queensland if they, if they have to quarantine here? Why is it okay that they get on a flight with other people that are going to other areas?
Well, it's far better, I would have thought, and most people will voluntarily. Rather, if you come here for a holiday or what have you, rather than being locked in a hotel room for 2 weeks, it's far better you go home. I just think it's a wise and sensible decision. This is the world we live in. These are harsh measures. This is unfortunate and unpleasant, and will wreck holiday plans and upset people. But this is the sort of thing we have to do in order to avoid what has occurred in other parts of the world. The Commonwealth, with our agreement, strong agreement, is halving the number of people coming back internationally. That will cause a lot of heartache, it'll cause a lot of pain, a lot of sadness, and we understand that. But these are necessary steps in order to protect the vast majority of Australians.
Can you break down the rules for people who will return to Queensland? So they have to alert police, head straight to the airport, wear a mask, that kind of thing?
I'll let the Deputy Commissioner outline that when I finish.
Did you push for a ban on flights from the UK?
Well, as you know, my statements over the last few days were, in fact, over the last couple of months, what I've said is that before you board a flight to Australia, you should be tested and have a negative result. I'm pleased to see that is now being implemented. So that's a strong development. In relation to flights from Britain or South Africa, I indicated that if the health advisors of the country said that we needed to stop those flights, then we should. They haven't indicated that for the reasons I just outlined, which is that the British variant has spread to at least 20 countries around the world. So therefore you could shut down to Britain, but the British variant could come in from another country. So they've said it's not a particularly effective measure. More effective measure is to reduce the number of people coming into the country, which we are doing, Australians returning home, and also make sure that we stop the spread out of Brisbane, and that is what all the states are doing. Western Australia is going further than any other state. We're just closing down to Queensland because as we know, COVID does not respect postcodes.
The Perth Wildcats are in Brisbane at the moment. Their season is supposed to start on Friday. Obviously, they'll have to come back. They'll be in quarantine. Would you consider an exemption to allow them to play and train while they're in quarantine?
These are the sorts of things we'll get health advice on, but I would expect they'll have to stay in quarantine. I'd expect, just if I can finish, Peter, we'll get further health advice on that, but the whole way along, we've just tried to have very strong, easily understood rules for everyone. And as unfortunate as it is, all of these things that are occurring just are part of dealing with COVID. I expected, as everyone did, that 2021 would prove to be better than 2020, but it appears it's no different. In fact, in many ways, it's worse. And so, therefore, we need to continue the precautions and the very cautious approach as we roll out the vaccine, which hopefully means that everything improves by the end of this year.
Would you like to see those international flights, like in Darwin, they go to Howard Springs, would you like to see those international flights move to Commonwealth facilities, detention centres, to keep them away from the general public? Because we are having people break out of hotel quarantine and things like that. It's
a very rare occurrence that someone breaks out, very, very rare. And obviously we beefed up security following that recent unfortunate event. Obviously we have said, and I said it for a number of months, that Commonwealth facilities should be better used and more heavily used. Howard Springs is I'm not sure if it's a territory facility or if it's a Commonwealth facility, but it's being heavily used in the Northern Territory and it's being used to bring back Australians into that environment. But I don't think it's feasible not to use our international airport, and that's the same for Sydney, Melbourne, Adelaide and Brisbane. So we'll continue to do that, but I am pleased that we've halved the numbers of international returning Australians until at least mid-February. But as I said, that will bring a lot of pain to many families, and obviously we're all very sorry about that.
Is it time to ensure hotel quarantine guards and cleaners don't work second jobs?
Yeah, that's also something that Health has been working on, about how to do that and how to enforce it. You know, we're looking at it. I understand Victoria's done it. I'm not sure any other state has done it, but how do you enforce that? And how do you ensure that even if you put that rule in place, that someone doesn't then do an odd job every now and then? Because many people in these industries have a range of jobs. So that's one thing we're looking at. But the big change we're really making today is the saliva testing on a daily basis for anyone who works in quarantine. So that will mean cleaners, security, it'll mean nurses, it'll mean drivers, it'll mean police officers, it'll mean airport workers. Anyone who works in the quarantine chain will have a daily saliva test put in place as soon as possible, and the weekly PCR test, which is basically the swab up your nose. So this is an additional precautionary measure. As we know, throughout COVID, we've had to continually ramp up and improve the measures we put in place. This is another step in that process.
So could that include potentially increasing the pay for quarantine hotel workers? So
Yeah.
they don't need those second jobs?
Well, that's one of the things we're looking at, and we haven't reached a conclusion on that. It's quite complex. And as I said, the problem will be you might put in place a requirement that someone doesn't clean elsewhere or doesn't work in security elsewhere or doesn't do some shifts in an aged care home as a nurse or whatever it might be. But enforcing that and making sure that it's effective is not easy. And so that's why we're looking at what models and what measures could be put in place.
Just on genomic testing, it took 12 days for some of those previous UK strain cases to be identified because of the weekly batching scenario. Is that going to be sped up for UK travellers?
Yes. I'm just trying to recall the exact details of that. But genomic testing, we are working. We basically get test results on a weekly basis. If there are urgent cases, I'm advised we can do it within 48 hours. So that's the sort of approach that we're working on with that sort of genomic testing. But the main thing is to have the testing capability in place to get results very quickly from our PCR and saliva testing, which is what we're doing.
Queensland has gone to mandatory masks in airports and on flights now. Obviously, mask wearing hasn't really been a thing here in WA, but should people have a mask on hand in case there is an outbreak here at any point?
So just in relation to that, we are going to mandatory masks at our airports and on our international and domestic flights. So that will be required. But my advice to every family and every household and every person across WA is make sure you have a reusable mask. Make sure you have one. So go and buy one. They're out there. You can get them. The government has millions on hand, should we need it. We have many millions on hand, should we need it. But I just urge everyone in the community, please go and buy a reusable mask just in case.
With the halving of international arrivals into WA, is it feasible, are you tempted at all to use Rottnest again as a sort of, somewhere that's not in the centre of the city, or is it not really?
Not at this point in time. Not at this point in time. We use Rottnest in those extreme circumstances where we had cruise ships arriving and we had mass arrival of people. At this point in time, we don't need to do that.
Just on the masks announcement you just made then, so if you're going to pick up someone at the airport, you need to wear a mask. And likewise, if you're, say, flying from Perth to Albany, an intrastate flight, will that be mandatory mask wearing?
Certainly. So the rule that the National Cabinet has agreed is if you are in an airport, you need to wear a mask. So if you go into an airport, wear a mask. If you are flying on an international or a domestic flight, wear a mask at all times. And if you are flying between Perth and Albany or Perth and Broome or Perth and Kalgoorlie or wherever it might be, wear a mask. That's the new rule. Now this will be, obviously, a lot of people won't like this, but they're the new rules. That's what we're putting in place in light of the UK strain of the virus to protect people.
People who don't comply will face possible fines.
That's right. That's right.
Taxi drivers and Uber drivers, should they be wearing masks?
I might get the Deputy Commissioner. The rule that the National Cabinet has agreed is within airports, on flights, domestic and international.
The vaccine rollout, there's provisions within the law, is there to sort of force that if there are people who don't want to get the vaccine? Is that something the state will?
No, there'll be uniform rules around the vaccine. So we expect a rollout in February, mid-February, of the first batch. And that will, in particular, be directed towards those people who work in quarantine, work in aged care facilities, and those people who live in aged care facilities around Western Australia, indeed around Australia. So it'll be a rollout around the country. Obviously, I asked the question actually of the national, the head of the Department of Health nationally. Some of them require this ultra cold environment, minus 70 degrees. So there's a rollout of freezers as well to ensure they can be stored. And that will mean a group of doses are rolled out around Australia, including both Perth and regional Western Australia, so we can immediately deal with that cohort of people who work in quarantine and work in aged care and the residents of aged care facilities. After that, the second batch will go out for the next cohort of people to be immunised and so on and so forth. So there'll be various cohorts at various points in time who need to be immunised over the course of this year. We're not going to make it mandatory, but it may well be at some point in the future that if you want to work in an aged care facility or you want to work in a quarantine facility or in a hospital, you are required to be vaccinated. And they're the rules that we'll work out over coming months about how that will work, but there's no suggestion that the vaccine be mandatory, but it may well be a requirement to work in some environments. So currently, we have various rules for people who work in some environments to be vaccinated for the flu, and it may well be a similar arrangement.
Do you think it was appropriate that Andrew Forrest was granted an exemption on arrival in WA from quarantine after globetrotting around the world for 4 months and coming through New South Wales?
West Australians who arrive in Sydney, Brisbane or Melbourne, if they do their quarantining in those environments, are provided an exemption to come back to WA.
And just to clarify, people that have been in Queensland since January 2 are expected to get a test today, that COVID test?
Sorry, I didn't understand your question.
People that have been in Queensland that are in WA right now have been urged to go to get a COVID test?
They've got to go, if they've arrived from Queensland from the 2nd of January, they're required to get a COVID test by Tuesday, and they have to self-quarantine.
Are you confident that our COVID clinics can cope with?
Yes. We are surging up the capacity in our COVID clinics as we speak to deal with this influx. We've told everyone who's arrived from Queensland since the 2nd of January they need to quarantine immediately. They need to get the test by Tuesday in order to satisfy our health requirements. We're surging up our quarantine clinic capacity in order to deal with that. But we do say to people, take a hat and bring some water. It's very hot outside. This is unfortunate, but there may be delays. And you've seen delays in Sydney, in Melbourne, in Brisbane. You've seen delays all over the world. This is the nature of what we're dealing with. Sorry, I'll say that again. You've seen delays in Sydney, Melbourne, Brisbane, and around the world. This is the nature of what we're dealing with.
Is this going to include increasing the opening hours of COVID clinics?
That's what we're looking at, but we do have COVID clinics and we also have private operators who can do the testing. So there's a range of locations in which people can do the testing. So we expect, as I said earlier, it's around 7,500 people from Queensland that will need to do it. If they want to get on the plane and go back to Queensland, well then that's up to them. But we expect that there will be some delays, but we are putting in place as many resources and as many hours as we can immediately.
So can WA just not surge fast enough to test the Queenslanders who have already arrived right now? We saw the same thing with Victoria. We didn't do that. We spaced it out. But New South Wales, we asked them to do it the first day, and we just had massive lines, and people got told to go home because WA Health couldn't deal with it.
We're surging up capacity in our COVID clinics to ensure we can do it as soon as we can, but delays are inevitable and they happen around Australia and they happen around the world. But I just urge people to be patient and understanding.
So are you happy with the fact that we can't just do it straight away and find out if people have the virus who've already been in the community sooner?
Yeah, we have to deal with with the situation that confronts us. So we increase the staffing, we increase the capacity, but an unexpected influx of numbers basically means that there are delays, and that is That has been the experience in every state and every country in the world.
On the saliva tests at hotels, obviously you'll need a lot of them, so where are they coming from, and are they a rapid test?
They're very rapid. You get the results quite quickly. So the way it'll work is if you work in quarantine. So as I said, in a hotel, in quarantine, you deal with COVID patients, or you are at the airport dealing with people, or you're a driver, a cleaner, a security guard, you're a police officer or a nurse, in any of those environments where you are in contact with people who may well be COVID positive, or at least are in the hotels, then you will be required to do the daily saliva test. Now, every state in Australia is doing this, and we have the capacity to do it, I'm assured, and we'll put it in place as soon as possible.
Alongside that uptick in testing, will there be an uptick in PPE protocols for people in that chain?
I haven't been advised that we need to improve the PPE above what we currently have in place, but I just say we have ample supplies of PPE. We have training in how to apply it. We have a fit testing regime for masks in place already, and we've expanded the number of people required to wear it. So we are doing everything we can to make sure we are as protected as possible.
In New South Wales, return travellers with a UK strain are being placed in special separate accommodation. Will you do the same thing?
We haven't considered that at this point in time, and bear in mind we're only aware of one or two people, in particular one who was in a hospital as we speak. Obviously that's something we'll consider over coming days. The only thing I'd say about that is, a person coming from Britain or from anywhere around the world will have had to have provided a negative test before they get here. So when they arrive, when they go into quarantine, if a couple of days after that, or indeed 11 days after that, they are subsequently found to be positive, then we'll have to deal with that person at that point in time. But if it's someone from Britain in a hotel, or someone with the British strain in one of our hotels, and then you have to move them to another hotel, that adds risk. So sometimes it's better to leave them where they are rather than move them. But obviously we'll take further health advice in relation to that.
And what is the benchmark there? How long would someone have to provide that negative test? Is it 48 hours? Is it within a week before travel?
It's a Commonwealth Government responsibility, obviously, to do this, so they'll manage that.
Will you be reducing the amount of hotels that are used just with the consolidating resources, just considering you're going to have less people coming in there?
I wouldn't have thought so, but obviously I'll let Health manage that. That's an operational matter. We will obviously at some point in time need to increase back to our current cap, which is 1,025 people per week at some point in time. But whilst there's this very, very fraught situation with what is going on with the British strain, and indeed the South African and the Nigerian strain of the virus, we need to reduce the pressure on our hotel quarantine. That's a safety measure. The Prime Minister and all the states agree that is the right thing to do.
Are you comfortable with current capacity limits, given there is so much more concern about this current strain? Is 30,000 people at a sporting event relatively full nightclubs? Are you still okay with all of that?
Well, at this point in time, I haven't had any advice to the contrary. Obviously, we're in a phase whereby we don't have full capacity at events. I've had a lot of pressure, by the way, to lift capacity. I know other states have had full capacity at stadia, and they've had, New South Wales has had cricket tests in the middle of the pandemic throughout Sydney. But I haven't had any advice that we need to change that at this point in time.
We'll be releasing the advice from today from the WHO, and is there a reason why we don't often have a representative from the CHO or a health perspective for questions from us?
Just two things. One, yes, we'll release the advice later on today. And secondly, as I recall, the medical advisors were out the day before yesterday. In terms of today's emergency meeting, which I just had, the medical advisors were on the line. They're in another location at this point in time.
Where are we at with wastewater testing?
I need to get your advice on that. But I haven't had any advice that there has been any problems with wastewater testing. The thing about wastewater testing is it's so sensitive that sometimes it will pick up cases, obviously through our hospitals or through our hotels. So it's not perfect. In fact, in some ways, it's actually more reliable in regional towns that don't share the metropolitan water system, sewage system. So that's the problem with it, that it can be so sensitive it picks up a case out of a hotel or out of a hospital, which are obviously in quarantine. So, but I haven't had any advice that there are any problems.
Just another sport one, the Sydney Thunder played a game in Perth last night. They've been in Queensland since January 2. The fact that they played a game in Perth last night, obviously had contact with that many people, having been in Brisbane, is that a concern at all?
Well, obviously anyone who has been in Queensland is now a concern if they've been there since the 2nd of January. So we'll have protocols in place for all of those people to quarantine and be tested. But my broad advice is if you've come from Queensland, it's probably time to go home unless you have a very good reason for being here.
Are you expecting cases of community transmission out of Brisbane, and are you expecting that hard border with Queensland to be in place for some time?
We'll take a medical advice on all of those things. I do know the Queensland government, the Prime Minister, the Queensland Chief Health Officer, the Queensland Premier are all very worried. They're all very worried. I mean, this morning's meeting, there's a lot of concern from everyone about what's going on and what has happened. And I think a lot of that is based upon all of the images that we see out of Britain and the British strain and this transmissibility issue. And so we have to deal with that. And, a lot of people will say we're way too cautious. And a lot of people will say that, this is upsetting their plans and their reunions, and that is true. And we're sorry that that's occurring. But the reality is, caution works. Being highly precautionary, being highly cautious, being very conservative about this works. If other countries had adopted the same approach, they'd be in a much better position. I might get the Deputy Commissioner to answer the questions that you asked that I didn't know the answer to.
Good morning. I'll just follow up on those few questions. I'll break down the people affected today into 3 categories. So the first one is the 7,500 odd who are currently in Western Australia who arrived from Queensland from the 2nd of January. They're all registered with the G2G pass. They'll be contacted immediately. The first step for them is to find a place of self-quarantine as soon as possible today. It will come into effect legally, enforceably from 12:01 tomorrow morning. Once they're contacted by the police, we'll be looking at that on a case-by-case basis. We'll be dealing with them individually to give them the best scenario, either to go home or to spend the 14 days here. As mentioned by the Premier, that includes being tested at a COVID clinic before Tuesday. The next group is the 1,500 odd passengers who are expected to arrive today, some of which already have. The first flight arrived at 10:10 this morning. They will be met with a very high degree of compassion, I might say. It's a very difficult time for them today, not knowing and boarding that flight without knowing what's just occurred. They will be tested at the airport today. They will be given a verbal direction to quarantine for 14 days. They may also be given the option, again it's all on a case by case, to return to Queensland. And finally, from 12:01 tomorrow, they'll be all passengers from arriving from Queensland will be subject to the same restrictions as New South Wales and Victoria under the medium risk category. So that is an exempted traveller. That means their G2G passes, if anyone had them approved, that they will all be cancelled, and those people who still intend on coming to WA must reapply through G2G pass. I'd also ask the 7,500 people from Queensland who are currently in Western Australia, and those arriving today and those arriving to the future, encourage them to download the G2G Now app so they can self-isolate and use a digital app to confirm their presence as part of their self-isolation. That prevents a visit by the police to confirm that they are abiding by the directions.
When do you conduct that visit to the 7,500?
So it's contacted first, so it's an email first through the G2G Pass application. It's usually followed up with a phone call. If you're sitting at home and waiting for it, you can call 13COVID if you need more information. But everyone is a case-by-case basis, and we'll be assessing them as quick as we can over probably the next 24 to 48 hours.
Do police go to the locations or their isolation addresses?
Not at this stage. Again, we assess them on a case-by-case basis. Almost all of them are helping us, trying to do the right thing, will give us clear instructions of what they want to do, and we're facilitating that for them.
The Premier touched on the sporting issues as well. The Scorchers are supposed to play a team who's now in quarantine tomorrow. The Wildcats will be in quarantine themselves for their first scheduled game next Friday. Is there any chance either of those matches can go ahead while those teams are in isolation?
That will be absolutely the discussions happening this morning. Queensland restrictions apply to everyone who has been in Queensland prior to January 2, or sorry, after January 2. That means we'll get health advice this morning and make decisions on those sporting games then.
When this similar case happened with Victoria, did you find that most people went back to the state or they isolated here?
Absolutely. Of the 16 or 17 odd thousand, I think we've had almost 8,000 return. We are currently, there's a number of West Australians, a lot of returning West Australians, so we expect a lot of the people coming from Queensland will in fact be returning Western Australians. So I will say, and happily, almost all of those people from Victoria, we're working very well with WA Police to arrange their situation. They either stay here in their 14 days or they have returned, but they've been absolutely fantastic to deal with, and we do want to thank them because it's a really difficult time for them, and I can only imagine how difficult it's going to be for the people from Queensland this morning.
Can you break down the rules of people going back? What do they need to do?
So each and everyone will be contacted. They will be guided through what they need to do. I think the most important thing is to reach out first. Before you do anything, before you go to the airport, before you leave, go into your self-isolation, call 13COVID, wait for the contact from G2G Pass and go from there. The police will give you those instructions.
We did see yesterday that police put out some failure to comply issues with 3 different travellers. Do you find on the whole most people are doing the right thing, or?
Yeah, compared to the number of people who are part of this process and who are in self-quarantine, the breaches are very minor. I know we've had some serious breaches, but on the whole there are very minor breaches. There are people who have gone for a walk or they've quickly gone down to the shop, they've received an infringement and they've been very compliant once we've spoken to them about that.
Are you in contact with your colleagues in other states and how they're coping with breaches?
Every day, there's a national coordination mechanism meeting that we have regularly. We talk about our different scenarios, and I'm very confident that we have the very best situation here in WA.
Given the stakes are higher with this new strain, would we see potential harsher penalties or stricter enforcement on those breaches?
Look, these are all considerations going forward. It means people have to be more mindful about the increased transmissibility of this strain, but we're not seeking, WA Police have a very clear way of dealing with this, and it's compliance through compassion. And we're not about whacking people unnecessarily. It's about talking to people, getting to understand the risk, and hopefully they'll follow the directions, and most people are.
So should taxi drivers and Uber drivers who go to the airport picking people up coming through the airport, should they be wearing masks?
Look, we'll get health advice on that. At this stage, that's not the advice I've received. Certainly bus drivers and those that are taking people to a centre quarantine hotel will be wearing those things. But as far as general passengers going to self-isolation, that's something I'll need to get advice from the CHO.
Any feedback yet on whether or not people are doing the right thing around safe WA in terms of checking in, or even businesses making sure people are checking in? Do you have any enforcement measures over that, or is it just that up to local government that they told you if that's been working or not, or if businesses haven't been complying?
I think you can appreciate the Safe WA app is critical. It certainly helps health track down if there is any issues, but it's also happening every day in the thousands and thousands. So enforcement is difficult. We ask the community to enforce themselves. We ask the shopkeepers and the shop owners and the people that, to be very compliant and making sure that those people are checking when they can. But I haven't received any reports myself of breaches.
We did see back in the heavier days of the pandemic in WA where we had limits on the amount of people who come into a building, and there still are limits, although sometimes it doesn't feel like it out there. Would you encourage people in the community to contact the police or contact their local council if they're concerned about the levels of people at venues, or if they're not following those rules?
Absolutely. I think the Premier was very clear when he said, we're not out of the woods yet. Everyone has to be very focused on doing the right thing, on understanding what wrong looks like, and people are doing the wrong things. And look, it's not about dobbing on people, it's about protecting our fellow citizens and the community together. We're all in this together, so I would encourage everyone to do that.
When this happened with Victoria, we talked to a lot of people who wanted to go straight back, and they found it very difficult to get in contact via the COVID line. You know, can you give just general guidance as to let police know what you're doing, go straight to the airport, wear a mask, as simple as that, even just to give people a bit of peace of mind, because they're terrified of doing the wrong thing.
Yeah.
$50,000 fine and so forth.
We're going to stick with our contact the police first, and I know there will be a delay. Now, in the Victorian situation, there was 16,000, so there was significantly more than there is today, and we've actually worked through those. The police will give you guidance, and yes, it will probably just include, get in a cab, go to the airport and leave within a certain time frame, but they must communicate with police before they do that.